Hello and welcome to the team-wide Person-Centered Positive Support Practices webinar on organizational workforce. My name is Julie Cramey, and I'm a researcher at the University of Minnesota's Institute on Community Integration and a regional trainer in the Minnesota Person-Centered Positive Supports model with your organization. This webinar is part 2 of a 2-part series on understanding your data to use your data for decision-making. Before you listen to this webinar, we ask that you've completed pages 1 to 3 in the Assessing Your Workforce Outcomes workbook. If you've not yet completed this activity, feel free to pause the video and come back later. This web series is brought to you by the Minnesota Department of Human Services and the University of Minnesota's Institute on Community Integration. It's designed to share the information scheduled to be shared at the remaining team-wide sessions that were canceled due to the COVID-19 outbreak. We encourage you to connect with your team about the activities and what you've learned. Have a virtual meeting, create small groups, or pair up if possible. Despite these difficult times, we encourage you to continue your positive momentum forward as you are able. Today's webinar concludes our series on understanding your data and using your data for decision-making. Using what you learned today, you can explore strategies intended to support your efforts to recruit, select, and retain high-quality staff. The webinars on recruitment, selection, and retention strategies are intended to equip your team to identify and select a strategy that aligns with your team's goals and track your progress towards those goals over time. The learning objectives for today's webinar are to understand the kinds of data that can be used to assess current recruitment, selection, and retention efforts. In this webinar, we will show you formulas you can use to compute some outcomes to help you do this. You can use these formulas to continue pulling your data over time and track your progress. The final objective of this webinar is to provide some comparison data for you to compare your current workforce outcomes to help you identify areas to focus your efforts with an intervention strategy. We know that many organizations are experiencing critical workforce issues, and we hope this webinar series provides you with some information to take steps to address one of them. In this webinar, we will use data you collected in the Assessing Workforce Outcomes workbook. If you've not yet collected that information, please pause the video now and do so. Make sure that you have the data in front of you when you watch the rest of this video so you can compute your outcomes with us. You can pull out that data to have in front of you now. In this webinar, you'll compute your organization's workforce outcomes. For outcomes that need to be computed with the data you pulled, we will provide you with formulas to compute them. Following that, you'll have a chance to compare your data to calendar year 2017 data collected from organizations in 2018 from the Minnesota Direct Support Workforce Project. These will not be perfect comparisons since they come from different calendar years, but they can give you guidance on how to interpret your numbers. Another option for comparing your statewide numbers is looking at the National Core Indicators Staff Stability Survey results. Minnesota does not participate in the NCI Staff Stability Survey, but other states do. A link to the website with these data are at the end of this presentation. At the time of this webinar's release, the 2019 data are not yet available, but they will be at a future date. Just make sure when you're looking at the staff stability numbers that you're also looking to see if the formulas match the one you use to compute your numbers. Now back to the Minnesota Workforce and Worker Surveys. The Minnesota Direct Support Workforce Project was a partnership between the Minnesota Department of Human Services and the RTC on Community Living at the Institute on Community Integration at the University of Minnesota. Several provider trade organizations and advocacy groups. The full reports are available online, and they'll be linked at the end of this presentation. There were 2 different surveys that were part of this project. The organization survey was completed on behalf of the whole organization by a person or people who had access to the organizational data. This is similar to what you did in collecting your organization's data. The worker survey was completed by direct support workers in Minnesota, and they asked workers questions about their experiences and perspectives. The results of both were intended to inform and expand the conversation in Minnesota about wages and benefits paid to the direct support workers and ways to recruit and retain them. For most comparisons in this webinar, we use the results of the organization survey, but sometimes the worker survey results provide helpful background information for you to consider. The aim of the Minnesota Direct Support Workforce Project was to better understand our workforce and the extent of the crisis in hiring and retaining staff, and also to engage in data-driven decision-making to address the workforce crisis and other issues. The results can help guide priorities on a larger systems level, but they can also provide a point of reference to determine how to support your own DSPs and to prioritize the efforts to recruit and retain good workers. The Minnesota Direct Support Worker Survey was sent to 444 provider organizations that were randomly sampled from the population of 1,272 organizations in the state that provided Medicaid-funded long-term services and supports to people across diagnosis types. 185 organizations completed the survey. The pie chart on your screen shows the percentage of people by primary diagnosis type who received services from the 185 organizations who completed the survey. You might recognize by looking at the pie chart that the organizations that completed the survey provided services across diagnosis types, and in addition by service types. The people supported by the provider organizations had diagnosis types of IDD, but organizations also provided services to people with physical disabilities, mental health disabilities, and people who are aging, as well as other diagnoses and brain injuries. Organizations that received the Minnesota Direct Support Workforce Survey also received the Minnesota Direct Support Worker Survey to distribute randomly to their workers. 267 workers completed and submitted that survey. In the workforce survey, we also analyzed organizational information by region where highest percentage of services are delivered. These data are available in the report linked at the end of this presentation. Feel free to look at the data in the report if you're interested for a regional comparison. However, spoiler alert, there were no statistically significant differences between regional data, except for in starting DSP wages and the outcomes of interest that we looked at. A quick overview of the DSP Worker Survey. The Worker Survey included questions about the demographics of DSPs, including their sex, age, household size, annual household income, whether they have another job, and their level of education. So what did we learn about who our workers are? Direct support workers in Minnesota are oftentimes women in their 40s and a household size of 3. More than half of the workforce has an annual household income below $40,000. For comparison, the median household income for workers across sectors in Minnesota is over $65,000, according to the Minnesota Management and Budget Office. This means that the household income of our direct support workers is well below the average household in Minnesota. Many DSPs work more than one job. This is not surprising, given that over half of the DSP positions in Minnesota in 2017 were part-time positions. Importantly, while DSPs are often considered entry-level workers, nearly 2/3 have education beyond high school, and nearly 1/5 have a 4-year bachelor's degree or graduate degree. As a first point of comparison, you can think about whether this is similar to or different from the workers you employ in your organization, and what kind of supports these workers might need on the job. Let's turn now to compute our workforce outcomes. We'll take each outcome in turn. You can do the computations right onto the workbook or in a workbook on your computer. We provide on page 7 of the Assessing Your Workforce Outcomes workbook an example of how you might collect the data for comparison. You can note your outcomes there as we go along or in another workbook, such as Excel. The first outcome we will look at are average wages and starting wages as needed. Specifically, what is your average wage paid to DSPs? To compute an average wage, pull your wage information you collected. Find the sum of DSP hours that you computed from all your DSPs on payroll. Divide that number by the number of DSPs whose wage data you collected. The result is your average hourly DSP wage. You can repeat this formula as needed for starting hourly wage if you pay DSPs a different starting wage. Some organizations pay differentials for DSPs, for example, at different sites or different service types. You'll want to know your starting DSP wage and your average hourly wage for this first workforce outcome comparison. You can pause the video to do this now as needed. On the last day of 2017, the average starting DSP wage collected in the Minnesota Direct Support Worker Project was $11.92 per hour. This was the awake wage as opposed to the asleep wages, which was reported in a separate item on the survey. I previously mentioned that this is the one item of interest in the Minnesota data where there were slight regional differences, with the metro region wages slightly higher than those in greater Minnesota. You might want to note those regional differences in the report, depending on where you provide services in the state. The average hourly wage on the last day of 2017 was $12.61 per hour. This is slightly higher than the starting wage, a point we will discuss more in a few moments. Noting that these data are 2 years older than your data, and you might have offered cost of living wage adjustments to your DSPs between 2017 and today, how do your wages compare? The next slides will have you have a bit more comparative information to help you think about the wages paid to DSPs. The first point of comparison is with the statewide cost of living in Minnesota. For this comparison, we use the OES data tool available online from Minnesota DEED. This means when we say that wages are low, we compare the hourly wages paid to DSPs to the statewide cost of living to help inform what we mean by low. How far does the money go to cover DSP costs, including rent, utilities, food, childcare, clothing, and other costs? Using the OES data tool available at the Minnesota DEED website and using the average household size of 3 that was reported on the worker survey, we know that $15.39 per hour is needed to support a family of 3 that includes 2 full-time working adults and 1 child. When the household size of 3 includes 1 working adult and 2 children, the cost of living is substantially higher at $38.25 per hour. This can inform some of the financial pressures that your workers are experiencing. It can also inform some of the supports you provide your workers. Your workers are likely to be living paycheck to paycheck. Do you have an employee assistance program, or can you partner with another organization to provide one for your employees? Can you direct employees to receive assistance through public assistance programs to streamline their availability to access those resources? Access to such resources may relieve some of the pressures your workers experience so that they can stay in this work over time. Some data from other studies have shown that DSPs nationally have not received a wage increase when adjusted for inflation for over 10 years. This may be a consideration to help you retain long-term workers. Making sure that employees who have longer tenure and provide high-quality supports are compensated at a higher rate than employees that were just hired. Later in this webinar, we compute average tenure. You might look specifically at those DSPs whose tenure is above average to assess how you're supporting workers with increased skills in this work through performance bonuses or evaluation bonuses. You can think about the gap between your starting hourly wage and your average hourly wage to consider the tenure of those folks who have been in your workplace over time and see if the wages correlate with the increased skill. You're likely well aware that some DSPs leave their positions when they simply can't afford to work when other industries pay more. Knowing this, one consideration is what you can offer your high quality and loyal DSPs, or how you can help them make their budget work to stay with your organization. Are there additional resources out there that could support this and keep them in this work? Unfortunate for our underfunded industry, one thing we do know correlates with high turnover rates are low wages paid to DSPs. Conversely, higher wages paid to DSPs are correlated with less turnover in an organization. While there may be other things that keep workers in this work, if there are any ways to increase DSP wages to funnel more money in terms of wages to your frontline workers, you are likely to have lower turnover rates. This is what's depicted on the screen right now. This is a study from over 500 organizations in the late 2000s who provided wage data and turnover data. And it was noted that the lower wages paid to DSPs were correlated with the higher turnover rates, which is on the left-hand side of the chart on the screen, whereas the higher wages paid are correlated with lower turnover, which is what's shown through the trend line on your right-hand side of the screen. There's another way to slice the pie in terms of compensation for DSPs. Government subsidies are available for low-wage workers in some areas of some states. We asked workers in the worker survey to report kinds of government assistance they access in order to help them pay living expenses. 71% of direct support workers indicated that they access government subsidies for health benefits. 30% access energy assistance. 23% access food assistance. Nearly 7% utilize child care assistance, and 5% utilize housing assistance. Knowing this, it might help some of your workers to provide resources on accessing these benefits as needed. Accessing such benefits can set some of your workers up for success to be able to stay in this work for the long term. It may help you to know what's available in your area and where to direct DSPs when needed. The next workforce outcome we will discuss relates to health benefits. The first question related to health benefits is, what percentage of DSPs are enrolled in health insurance through your organization? We know that some organizations in the state do not offer health insurance benefits to DSPs at all. If this is you, you can skip over these computations, but we ask you to watch the section on the Minnesota workforce data to think about ways you might support your workers. First, pull out the number of DSPs enrolled in health insurance and the number of DSPs eligible for health insurance. To compute the percentage of health benefits enrollment, divide the number of DSPs enrolled in health insurance by the number of DSPs eligible for health insurance. Multiply that by 100 to get the percentage of health insurance benefits enrollment. Feel free to pause the video now to do this computation. We know that in 2017, health benefits eligibility was an issue for many organizations overall, as well as for the majority of direct support workers in Minnesota. In 2017, only 56% of organizations offered health insurance to full-time direct support workers. Only about 11% of organizations offered them to part-time workers. For the organizations that offered health insurance to some or all of their DSPs, the percentage of those DSPs who enrolled in health insurance provided by their organization was 38%. Just over 1/3 of DSPs utilized the health insurance offered by their employer. 38% is the comparable number to what you just computed using the formula in your workbook. When considering uptake, it can be helpful to consider the costs of health insurance benefits. $142 a month was the average cost of individual coverage that the worker paid in 2017. This might be out of reach for some DSPs, being paid around $12.62 per hour. It's a significant portion of their monthly earnings. Health insurance benefits may simply be out of reach for many workers. On the direct support worker survey, we asked workers to report where they accessed health insurance benefits. The results of the survey are noted on the graph on the screen. Over 30% of DSPs accessed through government paid programs. About 28% accessed from their employer. Over 20% accessed from their spouse or parent. Over 10% do not have health insurance. Knowing this, can you provide resources to your workers about accessing government paid programs when you cannot offer health insurance benefits? We recognize that there's not an easy solution for providing health insurance in our current context. Our point about viewing this as a workforce outcome is being attentive to the numbers to better understand where your workers are at and to consider any options for addressing your workforce challenges based on anything that might be in your control. The next workforce outcome regards overtime hours. Given the high vacancy rate among DSP positions, many organizations ask existing DSPs to work overtime in order to meet staffing needs. The question related here is, what is the total number of overtime hours paid out to DSPs in the last year? No computation is needed for this data. Once you pull it from your records, you can note and compare the number from one year to the next. You may also be interested to look at overtime hours paid by quarter or month or even week to drill down and examine their staffing trends. In the Minnesota Workforce Survey, the average annual overtime hours across organizations was 8,047 hours. More overtime hours were reported by metro organizations than by organization in regional centers or greater Minnesota. Although it can also be helpful to note that overtime hours are somewhat dependent on the number of DSPs you employ and the number of people who receive services in your organization. So if there's more organizations in Minnesota that are larger, that number of overtime hours might also be larger. In the Minnesota Workforce Survey, organizations reported that the average direct support worker works 38 hours of overtime per year. Statewide, organizations reported spending over $35 million in overtime costs. This, of course, is substantial. Interpretation of these data are tricky, however. We know that some DSPs depend on working overtime to pay their bills. The time and a half that they earn in overtime helps them to make ends meet in their expenses. On the other hand, if there are ways to reduce overtime costs and just increase base wages for DSPs, the math might also work out in their favor without having to work so many hours every week. If you're seeking to reduce the availability of overtime hours to DSPs, be sure to take into consideration whether some of your longtime DSPs depend on overtime hours before regulating availability to work them. This is one way to make sure that you don't lose your longtime staff in the face of a new policy. On the other hand, if a new policy results in higher hourly wages for longtime DSPs, such a change may also be welcomed. Annual turnover is a common workforce indicator that you might already be tracking. There are a variety of ways to compute turnover. Some HR software systems will compute turnover rates automatically for you, and this can be an advantage to pulling your data and tracking it over time. When you pull those data, you'll want to make sure that you note if the formula that was used for computing turnover is similar to or different to the one that we're using today. The formula we used and used in the workforce survey was the annual crude separation rate. This includes counting all voluntary and involuntary leavers in the organization in the calendar year. It does not include on-call or temporary workers, but a head count of DSPs who left and the number of positions. Given the high rate of vacant positions, we include the number of vacant positions on the last day of the year in the denominator. The specific workforce outcome questions for annual turnover is, what percentage of your DSP staff left their position in 2019? To compute annual turnover, find the number of DSPs who left your organization in 2019. Divide that number by the number of positions on the last day of the year. The number of positions includes the number of DSPs employed, plus the number of vacant but funded DSP positions. Multiply this number by 100 to get the percentage of DSP annual turnover. Feel free to pause the video now to do this computation. In 2017, the annual turnover rate in Minnesota organizations was 39%. This means that 39% of the workforce leaves their positions in a year. There were no significant regional differences in turnover rates. It was high in all regions. The turnover rate is similar to other studies and those that have been conducted in the workforce over the last several decades. Stubbornly, the turnover rate in our field ranges between the high 30s to 50% annually. The interventions that we describe in the additional workforce webinars relate to recruitment and retention strategies. If your organization is burdened with a high rate of turnover, you're not alone. These strategies are intended to help you recruit, select, and retain staff. You'll want to track your turnover numbers when using these strategies. You might also wish to track your turnover during shorter periods of time, such as quarterly or monthly. It might take several strategies implemented to revamp your staffing practices, but we recommend implementing one strategy at a time, or delegating the work to sub-teams to implement each strategy. More on that in those webinars. Another very helpful way to examine your staffing patterns is to look at early turnover rate. What that means is that the percentage of DSPs who left the organization early in their tenure, which we define here as leaving their position between 0 to 6 months after hire. So the question is, of the DSPs who left in the last year, how many have been employed for less than 6 months? In this computation, we asked you to gather the number of DSPs who left your organization and were employed by you for less than 6 months. In many fields, this is considered early turnover. However, over time, you may wish to drill down even more deeply to your turnover within 3 months or within 1 month of hire if you suspect that many staff are leaving during those early weeks. To compute early turnover, that is, those staff who left between 0 to 6 months of hire, take the number of DSPs who left and were employed less than 6 months, and divide that by the number of DSPs who left in the year, which is the number you used in the annual turnover computation. Multiply this by 100 to get the percentage of DSP early turnover. Please note that this number is a portion of the staff who turned over in the last year. It's a percentage or portion of your annual turnover number that you computed in the last outcome. In 2017, 46% of DSPs who left the organization that year had been in their position for less than 6 months. This is nearly half of the DSPs who turned over in the year. What this points to, or likely points to, is the need to focus in on strategies to hire DSPs with the right expectations for this work and to provide the training and support that sets workers up for success early on in their career. Direct support is hard work, and competence in this work is gained over time. Providing support and a safe environment for DSPs to learn these skills and ask needed questions on the job is an essential component of their success. Such strategies are discussed in the companion webinars. We have two additional workforce outcomes to compute. The first is vacancy rate. The question here is what percentage of funded positions were vacant on the last day of the year? To compute vacancy rate, divide the number of vacant DSP positions on the last day of the year by the number of DSPs employed on that date and the number of vacant positions. Multiply this by 100 to get the percentage of DSP vacancy. You can pause the video to do this computation now. In 2017, 15% of DSP positions were vacant. This is extremely high compared to the Minnesota vacancy rate across positions, which was 4.4% in the same period. These high levels of vacancy may indicate that people are waiting for services, and as previously discussed, that lots of funds are funneled towards overtime costs. Direct support has always suffered from a visibility problem. That is, that many people in the public are not aware that these jobs even exist. There may be ways for your organizations to increase the visibility of these jobs and to provide public service announcements about the kinds of positions you have available. Or you can partner with schools or community colleges to provide a pipeline into direct support careers. If you become more selective in your hiring process for new DSPs, you might see your vacancy rates initially increase. This can sometimes be a trade-off in waiting for the right person to fill the position. On the other hand, this increases, of course, the difficulty for people who receive services and accessing work in the community. Knowing this can be important as you track your data over time so that you're planning accordingly and interpreting your data accordingly. Finally, it can be helpful to know the average DSP tenure of your staff. This means that the average length of time that your DSPs have been employed in your organization. The question here is, what is the average DSP tenure or length of time that they've been employed of your DSP staff? We know that direct support is technical and requires skill and expertise. Many person-centered supports require familiarity with the person receiving the supports and their loved ones. Trying to increase DSP tenure can be important in increasing the delivery of person-centered services. To compute average DSP tenure, find the total months of employment for all DSPs in your organization. Add together the months of employment for each DSP, which might be a very large number, depending on the number of DSPs you employ. Divide the total months of employment by the number of DSP positions, which includes the number of DSP employed on the last day of the calendar year and the number of vacant positions. Divide that by 12 to get the number of years. The result is the average DSP tenure in your organization. Feel free to pause the recording now to do this computation. Unfortunately, we didn't actually ask this question on the Minnesota Workforce Survey to compare your numbers. You can think about how long it might take your existing DSPs to become fully trained and competent in this work and try to increase your average tenure to that number. You may also want to become familiar with who are your long-term staff that provide high-quality support in your organization to recognize them for their service. This can be a positive support that impacts the morale of all employees and their commitment to the field. You have now computed all the outcomes in this workbook. You might have made notes as we went along regarding the comparability of your organization's data to the Minnesota average data from 2017. This might have helped you define a workforce challenge that you'd like to target with a strategy to increase recruitment, selection, or retention efforts of your direct support professionals. We also encourage you to think about where to put your data so that you can track them over time. On the screen is an example of how you might set up your data to be able to track it over time. On the left, each outcome that you computed is placed in a row. On the top margin, 2019 is labeled in a column for you to use to insert the numbers you computed. You can add numbers for 2020 and 2021 in January of the next year to track your annual numbers. You can find an example of this on page 7 in your workbook. You can use a table in a Word document saved in your team folder to do this, or you can also use an Excel file. Using an Excel might be preferable, as you can also use the charts function to plot your data in figures if you choose to do so. Or you might have another electronic database where you store this information. We recommend storing the data in a place where it's accessible for your team, so you can reference it when you are making decisions. You can also provide this information to your administrators and your board of directors, and any folks that are needed to keep in the loop about where your numbers are at. Now that you're familiar with these workforce outcomes and how to compute them, there might be additional ways that you want to slice your data. Additional considerations for computing and tracking these workforce outcomes over time might be to drill down on any number of attributes amongst your staff. You might want to look at full-time or part-time DSPs separately to determine how effective a strategy is on one type of staff or another. You may want to target your interventions to a particular site. For example, staff who work in group homes or family homes or employment staff. You may also wish to look at these workforce outcomes among your frontline supervisors, ensuring that they're well supported in their roles. In these cases, you would divide your list of staff by these qualities and pull the data according to the criteria rather than your full list of all your DSPs. In addition to tracking retention trends like those we've computed in this webinar, you might want to collect other types of data from your staff or organization about an intervention to give you feedback on how you're doing. Depending on the type of intervention you want to implement, these might be essential pieces of evaluation that support its success over time. For example, you might want to survey or hold focus groups to learn more about attitudes or opinions of your staff. You might want to include staff satisfaction surveys in your annual process. You might want to collect exit interviews as possible. You might already collect important data on performance and training standards that would help inform your efforts, including, for example, performance reviews or training needs assessments or job analyses. Finally, and especially important when implementing a new initiative, is providing cost and benefits analysis. What's meant by this is keeping track of staff and resources needed to implement an intervention and the cost savings that results. It's estimated that it costs between $3,000 to $5,000 to replace each DSP that turns over in our organizations. An intervention that increases retention can result in exponential cost savings for your organization when it results in staff that stay longer and provide high quality supports on the job. One example of this is a credentialing initiative in an organization in another state that was relatively resource heavy for the organization, especially as the curriculum was being developed. However, the increased skill and retention of those staff who went through the program has kept the program running over more than a decade of funding cuts and shifts experienced in the organization. Part of the reason for this is cost savings. It's a retention strategy that they simply cannot afford not to do, not only because of the staff that stay who participated in the program, but because of the supports that they provide and the support that they provide to other workers who stay on the job. The data you pulled in this activity can serve as a sort of initial assessment of your workforce. Your comparison to other organizations in Minnesota were intended to help you refine an addressable workforce challenge that you can address and evaluate your progress over time. Your next step is to work with your team to further define your workforce challenge. Explore the additional webinars to learn more about strategies designed to address a workforce challenge. With your team, decide on the challenge you'd like to prioritize. If you're like many organizations, you likely have several areas and strategies that you'd like to try. Make a decision about the one that you'd like to target first. Plan a strategy to address the need. Ask your colleagues for feedback on your decision and ask how they'd like to help. Next, with your team, put a plan into action. Add some tasks to your action plan and try to define some jobs or roles for your team members. Determine who else you might need to get on board to help implement the strategy. Do you need to work with your HR team if you're not already doing so? Figure out who you need to talk with to make sure you have staff and resources to implement the strategy. Evaluating the results of your strategy will be helpful for you in being able to track your progress and reinforcing to know that you're making a difference. Make sure to keep your evaluation numbers handy to review. Have an evaluation plan when you start, so you're tracking your progress as you go. Finally, using your evaluation data, revise your plan based on the evaluation. What worked and didn't work? What needs to be tweaked? What additional resources are needed? What bottlenecks are created in your process? Revise and repeat regularly. When thinking about your evaluation, now that you have your baseline measurements pulled together, make sure that the data you collected will give you feedback on how you're doing with your strategy. If you need to pull data on separate subsets of your staff, for example, part-time or full-time or your job coaches, pull those data and be sure to track them. Make a plan for ongoing monitoring. Plan how often you collect the data and add that to your action plan. Make sure to put it in a place to see your progress over time when you're evaluating its effectiveness. Plan to review your data periodically with your team. Your data are as useful as your time to review them. One thing to know is that when you implement a change strategy, it takes time to see that change happen. Plan for an extended period of time to implement. You'll learn lessons as you're implementing the strategy, and things may get worse before they get better, particularly as your staffing needs may have changed for other reasons, such as, for example, the COVID-19 pandemic. Allow yourself time for full implementation. When people have learned the skills needed to implement and are confident in the practices, you'll likely see a change in your numbers over time. Make sure to celebrate your successes with your team. When you recognize that you have met a milestone, take a moment to recognize the work that has been done. Finally, share your successes with others. Share with the people who receive supports from your organization and their loved ones and families. Ask them to tell stories about how your work to address workforce challenges, a workforce challenge, has impacted them. Ask their permission and share their stories on social media or in your newsletter. These kinds of stories, of course, are motivating to everybody. Finally, as we previously discussed, there may be many solutions to address your workforce challenge. It may take multiple solutions over time and a comprehensive approach. Plan to take that time and put forth your best effort. Make sure you take a team approach to move forward so you can work together and share efforts. You may want to look further into the data collected in the Minnesota Direct Support Workforce and Worker projects. These are available on our website at www.ici.umn.edu. You can search Minnesota Direct Support Workforce Project to be taken to the webpage where these reports are downloadable. Given that we discussed DSP wages and benefits in this presentation, we want to share some advocacy resources. You know, a lot of advocacy in our field happens from provider organizations and trade organizations, and this is vitally important. But the voices of DSPs are also important. We have compiled some resources on our website for DSPs to talk about this profession and some of the resources to support them in telling their stories and what to include when they're sending their stories to policymakers. There are some additional resources on workforce retention outcomes that are free on our website. Please feel free to access this retention calculator that provides some more extensive detail about the outcomes we discussed in this webinar. I mentioned that the National Core Indicators Staff Stability Survey contains some state-specific outcomes that are related to some of those in this presentation. You can access multiple years of free reports of these data on their website. Finally, additional resources for this topic and others can be found on the mnpsp.org website. I would encourage you to check out this site and select training materials at the top of the page. Thanks for your attention to this presentation, and feel free to reach out to your regional training team from the University of Minnesota with any questions you have. We're happy to help you in any ways possible and also to celebrate with you as you see results. We wish you safety in this time.